Now I would like to call Dr. Prakhyat Roop, who is talking about new revolutionary technology Z8.
Thank you so much, sir. While I set up, I'll introduce this new workhorse that we have got with us now, which is the Zeemer Z8. So this is the latest model of the femtosecond laser that this company is marketed for so long, and it's a very unique femtosecond laser because no other company has ever tried to even match the spot size or the low energy laser technology that these Zeemer technology machines have. So I'll right away jump into it. Now, the Zeemer Z8 is a true workhorse because it gives you everything that a femtosecond laser can do in one machine. So it saves you OT space, it saves you money, and it does everything, and it does it excellently well. We have the lenticule extraction, which is the latest development in lenticule extraction technology, which is clear. Then we have the femtosecond laser for cataract, which works exceedingly well. We have the Z LASIK, for which Zeemer is famous for a very, very long time. They have the smoothest flap in the world, and it's very well known the world over. So I'll not be getting much into it. And then we also have the keratoplasty platform, and the keratoplasty module has also been there for a long time. And Zeemer is the only machine that has such a wide variety of applications for keratoplasty. Uh, I am a consultant to Zeemer on clear technology, and I've been doing some research work for them. So I'll be speaking on the concept of low energy femtosecond laser because it is so important to know the difference between all the other femtosecond lasers and how Zeemer works to understand why it is beneficial. And then we'll talk about clear and cataract surgery. I'll briefly touch on what is in store for future. So if you look at the low energy laser, it is a continuous overlapping spot of a very small size 1/100th of what any other femtosecond laser machine delivers. And it is continuous overlapping spot rather than having space of corneal bridges in between. It is a continuous spot. And if you compare it to any conventional femtosecond laser, you don't have any tissue bridges in between. Now, so how does that help you? So in corneal lenticule extraction for advanced refractive surgery, that is clear. Let's first have a look at the interface, and then we'll discuss how it's different. So basically, this is how you mark. I've put my corneal marks, which I do with the GV pen on the slit lamp, and then I dock the patient on the machine. The machine allows me to center on the visual axis based on these marks. I can also correct for cyclotorsion based on these marks. I can correct up to -10 of cylinder, which is a very big boon because astigmatism is something which was not very well corrected in lenticule extraction. And then I get a real-time OCT picture of where exactly my incision is going to be placed. So this is a real-time image. I can know that this is where my incision is going to be placed. If it is correct, I can proceed. Otherwise, I can change the position of the lenticule. And then the cut goes on from the periphery to the center, and it has a venting channel for the excessive production of opaque bubbles which can be vented out and they don't remain in the interface. So it gives you a very, very smooth interface. And once the procedure is done, it takes a post OCT just for your own sake, and this is how you proceed further. Now let's talk about how well the energy is optimized in this technology. You see, in any other laser, there is a constant setting for energy spot, and that will be delivered from the periphery to the center, anterior and posterior both. This is the only machine that has customized the energy distribution delivered into the cornea as per the depth. So for example, I'll make it simple for everyone. For example, we are cutting the posterior surface, which is the refractive surface of which is the surface that is curved and is going to do the refractive correction in the lenticule. And we are delivering an energy which is equivalent to 40% of the maximum, right from the periphery till the center. And so, if you come to think of it, there is a huge difference in depth of the cut at the periphery as compared to the center in the lenticule cut. If I deliver equal amount of energy to all the whole depth of the cornea, then at least somewhere I am delivering excessive energy. This is what the customization of energy is. So what they did is they customized the energy delivered to the cornea based on the depth at which it will be delivered, so that it does the job, but it is not an overkill. So what happens is that the energy goes on increasing as you go from the periphery to the center. So you are delivering much lesser energy in the periphery where the cut is more superficial, and as you go deeper, the energy goes on increasing. Now, what that does is that gives you a very, very, very smooth interface. There is excessive energy is eliminated, and you're getting exactly the amount of energy that is required to produce a very smooth cut, which can be dissected very easily. And I'll show it to you here. So this is how the microscope looks like. We have to attach our own microscope, which is another freedom that I feel is a very personal preference. Anybody can use whatever optics they like. So this is how the interface looks like. This is the cap cut that I am going to dissect first, and then we'll move to the lenticule cut. And you can see that my spatula or the dissector passes very smoothly, and then I go into the posterior plane and I can easily sweep it. It is it is completely separated. I just have to just take it out by just sliding my instrument and just removing the sticky part of the stroma. Basically, just the hydrophobicity of the stroma is holding the lenticule inside. I can actually remove it out just by flushing it with fluid. So this is the posterior, and I can easily slide my instrument, and there's no problem of any tags, no problem of suction losses, no problem of attached black spots, segments, things like that. It's easy, and the eye looks pristine as before. And the best part about this is that I have never had a problem in doing the surgical maneuver of taking out the lenticule. That is the best thing about it. With the energy optimized trajectories, we are achieving up to 90% patients at BCVA on day one. So 90% of the patients are 6 by 6 on day one. And by 1 week, it is up to 99% or so. And higher order abrasions are much lesser than any other lenticular extraction platform. So it is a very, very good tool, and I'm really happy with it. Coming to the cataract in Z8, so it is a very, very unique platform in the sense that it delivers excellent centration. It is a liquid lens interface, so the IOP doesn't rise, and then you get a very, very good and intact strong capsular rhexis. The reason is that once you do the rhexis in a femtosecond laser machine, you realize that because of the missing spots in between, you get tags of capsule, and when you do a hydrodissection, there is always a risk of it opening up. In this, you don't have that risk. The second thing is it has a very good arcuate incision. So if you see the LRIs, then the LRIs are very predictable and extremely precise in depth. This machine takes 3 scans at the meridians of the LRI that you have planned, and it will show you on a real-time OCT what is the depth of the LRI. You can customize it to your own needs, and then once you do the start the laser, you can see that it will give you a real-time picture and the OCT scan after every step of the procedure, and you can bypass any step, skip any step if you want at any time. So I do all the things. I do the incisions, I do the capsulotomy, nucleotomy, and the LRIs in all my cases. And it always works extremely well. And I will show you how. So you can see that I've opened my side port, and I inject intracameral anesthetic, which I always do in all my cases. And then I open the main incision with my incision opener, and you can see that it easily slides in and opens. The capsule is always free. The CCC is always a free floating rhexis, and you can just take it out. And I'll do a hydro without having any fear that the rhexis might give way and I'll have an anterior capsule tear, which used to be very common with the previous platform that I was using, which was LensX. And then you go in and you see that the nucleotomy is already very well done. I'll just separate the piece and just pull it with just vacuum. So I am on pedal 2, vacuum aspiration, and I just take out the piece and then I emulsify it. So it's that easy. And I don't have to chop really deep. The cuts have gone well into the posterior part of the nucleus, and so the pieces are completely separate. So very easy and very ideal for premium lenses. So amazingly good. And then you can see that I have already done my LRI and won't even open it because it's the cut is continuous and smooth. LRI always works. And this I've implanted the latest addition to the Care Group technology, which is the Naturo panfocal IOL. It has no rings, no dysphotopsias, and it is a trifocal, which is pupil independent. So this is how the surgery goes with respect to cataract. So the advantages, basically, like I said, it has a brilliant CCC and effective LRIs, which are the two most important things which lack in any other femtosecond platform. Apart from that, I think everybody knows all the aspects of a femtosecond laser. Now, what the future holds in store for us is a faster cut for clear with reduced cutting time and a smoother cap cut with lesser overlap, which is going to further decrease the energy and time consumed and further improve our results. And also in the works is the Galili workflow integration, so that we won't have to mark manually, but we can just capture the image on the Galili topographer and transfer that image directly to the Zemer Z8 machine. So this is just a research case that we did during the development phase, and you can see that it has a different anterior cut, and so it has a much smoother anterior interface, and this is the anterior pass that is happening in green animations, and you can see that it has a broader scan beam which works much faster. And if you look at the interface, you can see that it's virtually no bubbles at all. So that's the end of my presentation. I'm happy to take any questions.
One thing I want to ask you, what is the incision size? Those it's safer to extract the lenticle when you're doing that?
Sir, I am currently doing a 2.2, but I think it depends from your when you begin doing a lenticle extraction. I think it's better to have a at least 3 mm size so that you don't do cap tears. But once you've developed the muscle memory to just remember the fulcrum is at the incision, and you've learned how to dissect on the side of your dominant hand basically, then you can reduce the size. So it's completely depends on you.
This machine is an advantage because the laser application is really customized according to depth of the cornea.
Exactly.
That is the main advantage of this machine over others.
So this is this I showed you a very simplified thing to understand by example, but it's actually a constant change from the periphery to the center. It's not like stacked that it's done manually. It's a delta that is directly proportional to the depth, which is the best possible way to customize energy delivery.
Yeah,
that is possible.
That is the advantage with this machine. Thank you.
No, sir.
So now,
sir, sorry, sir. For clear?
For the surgery, which toric marking system you are using?
Sir, we mark on a slit lamp.
No, but on the microscope you have some attachment, which was showing the toric marking on the cornea.
No. Okay. That is done on the slit lamp. Yeah. So we do basically to compensate for cyclotorsion. Okay, you have to have
In setting
a
first.
marking done, or you can have an integrated system like IOL Master with the Zeiss
Yeah.
microscope.
Okay.
But I don't have a Zeiss marking system. So I do a manual marking on the slit lamp, and then when I shift the patient into the OR, the machine automatically detects the GV marks, the gentian violet pen marks,
Okay.
and it aligns itself on those marks.
Thank you, Doctor.
Thank you.